I want to see if I qualify for a suture or an incisional technique, because I'm actually really scared of going under the knife and stuff, and I was hoping I would be qualified for the suture. Mainly because it wouldn't be a really dramatic surgery where you'd have to cut out, you know, parts of my eyelid and stitch it back up, whereas the suture, it sounds, you know, almost pain-free, and it's also reversible. So that's one thing that I really liked about that. If I decide that I don't want the way that looks, then I can just take out the suture. I wanted to look exactly how it looks if I had eyelid tape on. It gives it more height, the height of my eyelid, so when I apply makeup on, you can actually see the makeup. I do have a crease right now, a natural crease. I just want the same shape, but higher. When I use tape, it sometimes does make a double fold at the very corner of my eyelid, but that doesn't bother me at all. So if that was to happen with the suture, I'd be totally fine with it. My girlfriend's wedding is actually next month on the 30th. Yeah, I was hoping by then I could just have the crease and not have to worry about eyelid tape in photos, because, you know, when they have the professional cameras, you can see the tape. So I was hoping if I do get the surgery done, then I don't have to wear any more tape and I can just put on makeup as it is.
Cindy, you came to see me today about double eyelid surgery. What would be your objectives in terms of changing the shape of your eyelids?
I'm trying to achieve a higher crease. I do have a natural crease right now, but okay, I find it's way too narrow and skinny, and when I apply makeup on it, once I look straight at something, you can't see the makeup at all.
Okay.
So I guess the lid kind of folds over.
Right.
So I'm trying to achieve a higher crease.
Okay. Do you like the position of your crease now with the tapes in place?
Yes.
Okay.
Yeah.
So would that be roughly your goal then, to try and get a crease that forms all the time?
Yes.
Roughly where you have it now with the tapes? Okay. I think if you can easily create a crease just with gentle pressure from tapes, then you may be a candidate for a technique where we create a crease for you with a small stitch underneath your skin.
So Cindy, it's been a week since your double eyelid surgery. You had a little bit more discomfort during your surgery, I think, than some. But how was the rest of your recovery during the week?
It was fine. After the first day, it was already no pain at all. It didn't bother me blinking, anything like that.
Terrific.
I like my eyes now that it has the effect of when I used to use tape. When I put on makeup now, it actually shows all the makeup, all the eyeliner, all the eyeshadow. I do have one double fold in one eye, but Dr. Buonassisi already told me that that might happen before I proceeded with the surgery. My girlfriends were really excited, I think a little more excited than me. So every day they would ask me for a picture, and every single time I send them a picture every morning, they'd be like, "Oh my God, it looks so good!" So they're really excited for me, especially because some of my girlfriends also use tape, and they kind of want to get the procedure done too, but they haven't yet. So to see my results, I think they're really excited and happy for me.